Pertussis, commonly known as whooping cough, is a highly contagious respiratory tract infection caused by bacteria that is spread largely by coughing. The condition may affect people of any age, however, it can be life-threatening for infants and young children. Symptoms are difficult to treat, but the disease is easily prevented by vaccine. Pertussis is caused by the bacteria Bordetella pertussis. The pathogen is transmitted via droplets in the air from an infected individual coughing and sneezing. Once transmitted, the bacteria undergo processes that enable the disease to damage the lining of the upper respiratory tract, invade the cells of the body, and produce symptoms enabling the disease to be transmitted to others. To facilitate this process, Bordetella pertussis uses several virulence factors that inhibit the body's immune response. Among these are specialized mechanisms that work by masking Bordetella pertussis from the immune system, preventing the destruction of Bordetella pertussis, and inactivating immune cells and preventing them from entering the area of infection. The symptoms of pertussis present in 3 stages: catarrhal, paroxysmal, and convalescent. The catarrhal stage resembles cold-like symptoms, with a runny or blocked nose, low-grade fever, and a dry cough. After 1 to 2 weeks, in the paroxysmal stage, the cough turns into violent coughing fits, forcing the lungs to empty and causing the characteristic whooping sound when a person breathes in. The cough may also be followed by vomiting. In infants, they may not cough but instead have pauses in breathing known as apnea and turn blue known as cyanosis. While in older children, adolescents, and adults, an incessant cough may be the only indication of infection. The convalescent stage may last for several months, where the severity and frequency of coughing lessens and progressive recovery is made. Here is a short example of whooping cough.
Owie, you okay, buddy?
Preventative treatment is the most successful approach to dealing with pertussis, as well as the least expensive. Vaccinations are free for all children, adolescents, and pregnant women in their 3rd semester. If infected, the first and only line of treatment is antibiotics. They can help to reduce the chances of spreading the illness, as well as possibly reducing the intensity and duration of symptoms. Recommended antibiotics are listed. Of these, erythromycin is the least expensive and most common option. The best evidence states that prevention and early detection of pertussis is vital. It is recommended that children are immunized against the disease with the diphtheria, tetanus, pertussis vaccine in order to avoid contraction. If a child does begin to present with any of the symptoms, the best course of action is to visit a GP as soon as possible. Your GP will be able to assess and identify the illness promptly, as well as prescribe antibiotics to commence treatment as soon as possible. Your child should also be removed from school until they have been on a course of antibiotics for at least 5 days to avoid spreading the disease to others. It is important to monitor symptoms, especially if they continue to worsen, as hospitalization may be required. Otherwise, complications can arise such as pneumonia, rib fractures, seizures, apnea, cardiac failure, hypoglycemia, and in extreme cases even death. At hospital, they will be able to receive intensive medical care to avoid or treat such illnesses. It is recommended that infants are hospitalized regardless, as soon as they begin to show symptoms of pertussis. Thank you for listening to our video on pertussis, and remember, don't wait, vaccinate. For further information, refer to the sources listed.